am Lavanya, Department of Chemistry, Savita Engineering College. I am going to teach about HIV and AIDS. This is the contents of HIV and AIDS. First one is introduction, function, transmission, symptoms, and prevention. Then introduction, AIDS stands for acquired immunodeficiency syndrome, and then HIV stands for human immunodeficiency viruses. Generally, globally, 85% of HIV transmission is heterosexual. So this is the HIV functions. It is one of a group of viruses. It is known as retroviruses. The virus kills or damages T helper cells of the body's immune system. And then the body tries to keep up by making new cells or trying to contain the virus. Then HIV wins out and progressively destroy the body's ability to fight infection and causes certain cancers. So this is the transmission. Having sex with an infected partner, and second one is the virus can enter the body through the lining of the vagina, vulva, penis, rectum, or mouth during sex. HIV frequently spreads among injection drug users who share needles or syringes. HIV spreads through transfusion of contaminated blood or blood components. If tissues or organs from an infected person are transplanted, the recipient may acquire HIV. Donors are now tested for HIV to minimize this risk. This is the symptoms of HIV and AIDS: fever, headache, tiredness, enlarged lymph nodes in the neck. Then how to prevent HIV? So there is no effective vaccine against HIV. Avoid sharing needles or having unprotected sex. Do not share needles or inject illicit drugs. If you have engaged in risky behaviors, get tested to see if you have HIV. Follow recommended guidelines for protecting yourself against HIV. The risk of HIV transmission from a pregnant woman to her baby is significantly reduced if the mother takes medication during pregnancy. Have sex with a single partner who is uninfected. Use a condom in other situations. Condoms offer some protection if used properly and consistently. Medication helps the immune system recover and fight infections and prevent cancers from occurring. Eventually, the virus may become resistant to the available drugs and the manifestations of AIDS may develop. Drugs used to treat HIV and AIDS do not eliminate the infection. HIV prognosis. It is important for the person to remember that he or she is still contagious even when receiving effective treatment. Intensive research efforts are being focused on developing new and better treatments. Although currently there is no any promising vaccine, work continues on this front. Thank you.